Adler's Common Hour on Sex and Psychedelics. And this is co-hosted by both the Students for Sensible Drugs and the Society of Sexology. I am Dr. Karen Caffee. I will be the moderator for this panel discussion. And I just want to announce to folks, one, we would appreciate if during the panel discussion itself you remain muted. Any questions that you have for the panelists, we will do a Q&A towards the end of the presentation. Please throw those questions in the chat. I will read them off to the panelists for the Q&A portion for you, okay? And if you have any questions during the presentation, again, throw them in the chat. And so now I will let the panelists introduce themselves and we'll get started, okay?
Wonderful. I am Goldpaugh. I am thrilled to be here today. Thank you so much for inviting me to be part of this panel. I am a psychotherapist practicing in Woodstock, New York. I am a psychedelic assisted therapist and an integration specialist. I'm a clinical consultant and I'm also an author. I've written this book, Embrace Pleasure, and it is the first book to be published on the intersection of psychedelics, sexuality, spirituality, and pleasure. I've worked in psychedelic clinical research as well as private practice contexts, and I've been very lucky that I've also been able to learn from indigenous wisdom holders of these medicines. So I'm thrilled to be here today. Thank you for having me.
I am Sura Hertzberg, and it is a pleasure to be here with all of you and with you, Dee Dee. I am a psychotherapist in San Francisco and an intimacy coach and sex therapist. I come from performing arts and so embodied practices, and came at psychedelics pretty honestly from, a teenage experience in the woods, sort of fully releasing into whatever, and have been practicing ever since. I'm a psychedelic assisted therapist also, and I do integration work with individuals and couples. And I'm the founding director of this magazine here. These are our 3 first issues. My partner said they looked silly here, but I think they look cute. And it's an arts-based, arts, essays, research, poetry magazine on sexuality and psychedelics, bringing together a lot of the voices in the fields in sort of a consolidated way.
Thank you both. So we'll go ahead and dive right into these questions for you. So our first question is going to be towards Sura first, and it is, what is happening at the intersection of sex and psychedelics today, both culturally and clinically, that you can share with us?
Yeah. So I started this magazine about 3 or 4 years ago, and at that moment, it felt like there were a lot of kind of mushroom bodies from this mycelial network over here and over there, and people were kind of doing work underground, writing about it a little bit, talking about it a little bit, but there wasn't a lot of, at that moment, like really focus on this as a topic. And since then, it's sort of again and again been centered in public discourse, both at MAPS and Shakruna, having sort of focused talks on specifically sexuality and psychedelics. There's been some budding research in the field. Tommaso Barba is somebody who we're colleagues with, and it's wonderful. Released a paper with the Imperial College of London about using psilocybin, just about kind of how sexual functioning is enhanced through the use of psilocybin, and particularly how psilocybin can be used for like depression treatment. And one of the issues with current depression treatment is often like a lot with SSRIs. It's known that they reduce sexual functioning or sexual enjoyment and pleasure. And psilocybin, it seems, does not do that. It seems, also through a lot of practical, like experiential reports as well. So not just in the study side, but and then clinically, again, a lot of different folks are working in this intersection, like Dee Dee. Also across California, there's a few different organizations. Enamory is one that's doing couples work. Doorway Therapeutics is doing sex therapy with psychedelics. And then in Europe, there's a couple. Beautiful Space is a wonderful organization run by Sarah Tilley. Essentially, my feeling is like any time that these topics are focused on and centered, there's so much desire to talk about it, both at MAPS and at Chacruna, and I'm sure other places that I haven't been, there's lines out the door for conversations starting, at 9 a.m. And people are really chomping at the bit to have these conversations, and to do it in a way that feels like it's resonating with like their own internalized experience, where people can have space to dialogue about like scary things that happened or not so nice things that happened, or risks, or things that didn't go well as ecstasy and spirituality, and is it normal to fuck God, and kind of experiences that people are having that they don't have a landing place for. Yeah, I'll pause there. I have a lot to say. I'm sure Dee Dee and I could speak for hours on this, but I'll pause there.
Well, I'll add a brief addendum to this. And really, Sura, this is such a credit to your work, because I think one thing we've seen in psychedelics in the past decade, especially, is the heavy, heavy medicalization of substances that were once part of our culture and associated with free love and collective liberation. So
Mhm.
we've taken those medicines, which were once very entwined with the sexual culture of the United States, and we've put them in service to treatments. And there's a lot of good that comes from that, because we have revolutionized treatments with mental health. I mean, we're at the beginning of a new era of mental health treatment. So I'm not in any way against that, but there's something that has been lost at the same time. And one of the things that I think where Sura and I really overlap is bringing the conversation about pleasure back into the picture. Because as soon as you medicalize something and turn it into a treatment for specific pathologies, and I can speak later about like how exactly psychedelic assisted therapy can look in collaboration with sex therapy practice. And still, I mean, it was so worth it to me to write an entire book about psychedelics and pleasure, because one of the most powerful healing aspects of these medicines is that they are pleasurable and they cause us to be more in touch with our bodies, more in touch with our sexuality and our sensuality, and specifically our erotic energy, which is our life force energy. So I look at all of those things under a large umbrella. So I will also leave it here, because I could talk forever about this topic.
Okay. So then we'll move to you, Dee Dee, to start us off with, if you could talk to us a little bit about, where have you find psychedelic assisted therapy being most helpful as a treatment model?
hmm Well, first, I'm going to speak to why psychedelic assisted therapy is so incredibly important, especially in the domain of sex therapy. I'll keep it relevant to our topic today, and then I'll talk about the where. So, the first thing that I want to touch on is enduring research, meaning multiple research studies looking at different kinds of medicines in different kinds of contexts, give us three very central findings that I think are incredibly important when we think about psychedelics for healing our sexuality or sex therapy practice. And the first is psychedelics induce a quality of openness. So that's a personality domain that's generally thought to be relatively fixed in adulthood. How open are you? Psychedelics can cause, specifically psilocybin in clinical research, causes an opening of this personality domain of openness. So in my sex therapy practice, one thing I see very commonly is very rigid sexual narratives that are linked to our sexual self-esteem. Psychedelics can help to open that window of openness. The next thing we know from enduring research is psychedelics can increase the capacity for mindfulness, sometimes in cases looking parallel to what people experience after years of meditation practice. So, as a sex therapist, what I'm thinking of there is attuning to our body's cues, really looking at how present can we be in intimate experiences somatically and emotionally, because often what gets labeled as sexual dysfunction is really difficulty with for many reasons, with staying focused on in the body and in our emotional and spiritual selves. And the last is that psychedelics induce empathy. I do a lot of couples work in my practice, and we could all use more empathy. We could use empathy for ourselves, but also I've seen in my integration practice with couples that after psychedelic experiences, there is an increased openness and empathy and softening towards ourselves and our partners, which can cause breakthroughs in couples therapy. So these findings all help to answer the question of where do we see psychedelic assisted therapy being helpful? So I'll tell you a little bit about my practice specifically and how this kind of looks in the world of psychedelics and sex therapy today. One of my treatment specializations is working with survivors of sexual trauma, many of whom were traumatized in childhood or child sexual abuse survivors. Um, we have substantial evidence to suggest that psychedelics, the most researched of which is MDMA, are incredibly helpful at reducing the symptoms of trauma. I phrase it that way specifically because I think that there's a misunderstanding in the field that certain medicines are good for certain things. And I believe that actually finding the medicine that is the right medicine for you as a person is much more important than the equivalency between a certain medicine and a certain condition. But what we do know is what medicines have been well studied for certain conditions. So the first thing I would say is that for trauma work, the most study we have is around the substance MDMA. MDMA works by reducing activation in the amygdala, among other things in your body, causes this neural hormonal cascade of neurotransmitters that can help people to rapidly reprocess trauma. The next area where I think psychedelic assisted therapy is going to get applied robustly is couples work. So I've been a facilitator in ketamine assisted couples therapy retreats in and of themselves, and sex therapy focused couples therapy retreats. And you wouldn't necessarily, or something like, I did not think a medicine like ketamine would be the most obvious choice, but it's legal, right? And we can work with it easily as independent practitioners with medical supervision. So it's a medicine that's getting deferred to a lot in the therapy world right now, more in private practice settings, which we're at the brink of that expanding wildly. But the work that's being done with ketamine, and I think many other psychedelics, in couples therapy is really about reducing defensiveness. It's about finding spaces for connection, and it's about being able to process difficult material. And so the last thing that I'll touch on in this topic in terms of modalities, my work is really very centered on the intersections between sexuality and spirituality. And one thing many psychedelic medicines do is induce what is called a mystical experience, meaning we have a direct personal embodied experience, which, by the way, is an erotic experience of being close to the divine or whatever your conceptualization of God or a higher power is. In my integration work, spirituality is an anchor to how I approach sexuality with my clients because it is often the piece where we're first trained in organized religions to hold so much shame. And it is a very big gap between sexuality and spirituality for many people. And I believe psychedelics have a very powerful capacity to help us close that gap. So those are some of the areas that I think are expanding in the practice of psychedelic assisted therapy and how these medicines can help us.
Gorgeous. I think the one piece that I want to hop in on again is just the importance of eros and the erotic And that when we say sex and psychedelics, or we're talking about sexuality and psychedelics, we're not just talking about sex, and we're not just talking about sexual trauma healing. We are talking about all of these things, but we're also talking about the experience of being embodied. And we're talking about pleasure and joy and sensuality. And, if we do look at the medicalized version of this, oftentimes what the medical world is trying to do is kind of improve functionality and improve, productivity and capacity to operate in the mainstream world. And, for probably all of time, but definitely sort of in the West, psychedelics have been seen as countercultural or as sort of against productivity and, against sort of the mainstream. And so we're in this moment where we're bringing these worlds together. And I think that one of the exciting things about this is, in my mind, and I think for Didi also, it's like we're focusing on like pleasure and joy and presence and embodied response, and not just like, oh, well, can you test well on these measures. And so I think that's really important when we're talking about sexuality, and I think we'll speak to this a little bit more later, but we're not just saying like, again, like, can you do these tasks better, but more like, can you be more in your erotic body? Can you enjoy life in a sensory way more? Are you happier? I mean, these aren't always the names that we're giving to it in the research realms, but that's essentially what I think we're focusing on.
And I'll just add a slight addendum to that as well, Sura, because I absolutely agree 100% with what you're saying. What gets overlooked in research, where I think really psychedelic assisted therapy, because it's been so narrowly focused in clinical research, really fails us, is in two areas. One, that healing is not necessarily about focusing on the worst things that have happened to you or fixing a dysfunction. They're
Mm,
about being present with pleasure in your life. That itself is transformative. And the other word you will never see in a research study, but is crucial to everything we're talking about today, is love. The capacity to actually love more
mm,
deeply, to love yourself and other people. That's not a clinical measure. And yet it
mhm,
is the most important thing that these medicines can help us do. Because if we're working with these medicines and they don't make you more loving, what are you doing it for? That is the
mhm,
core of everything, is being
mhm,
more alive in our human body and being more connected to love.
mm. Yeah. That's so true. And just as practitioners, how do we experience love, and where can we find our capacity for love for our patients and for one another, for ourselves? And spirituality, love, uh, eroticism, these are also words that often get left out of in the practitioner's realm as well.
Yeah.
And so when we can bring this back as something that isn't scary or bad necessarily, and holding space for also when things are murky and we need to pull back and understand also where things can go wrong. But we've been so afraid that things are going to go wrong that I think we've held ourselves back from a feeling of love and pleasure and joy and erotic embodiment as practitioners. And how can we find our way back to that, um, to support and guide our the people that are with us, not just our patients, but our friends, lovers, fellow practitioners, etc., without crossing the line and understanding where the line is.
Thank you. So this next one, I'm gonna have Didi to begin the question again. I'm curious to hear more about the ethical considerations here that I believe Sura was just kind of alluding to that we were going to get to, right? What are the ethical considerations such as consent and boundaries? And what concerns do you each have around that? And what are some of the best practices you've then learned through your career on how to practice ethically when we're talking about sex and psychedelics?
Yeah, it's actually a perfect dovetail question, right? Because I think if we put it in the best light, practitioners are worried about these qualities of eroticism, connection to love, because they want to avoid harming people, right? And the way that we avoid harming people is to be ethically rigorous. And so I'll talk a little bit about ethics from a few different perspectives and consent and boundaries in psychedelics. So the first is just to acknowledge that ethical violations have occurred. Some of them, if you are aware of the world of what's going on in psychedelics assisted therapy, have been widely publicized, as they should be, as cautionary tales. So I'm not pointing to any specific incident, but I have worked both with survivors of sexual harm in psychedelic spaces, as well as have supported in therapy people who have perpetrated that harm and have been involved in restorative justice. So I've really seen the harm issue from a lot of different angles. So I think the first is to acknowledge that we don't have any research that sexual harm occurs more frequently in psychedelic assisted therapy than it does in any other kind of therapy. Sexual ethics violations are the most common violations against therapists in general. And the one thing I can say about the psychedelic community is I think it has been an imperfect response, but there is an attempt at response. These things are getting talked about. So let me talk a little bit about why and things that you'll be thinking about as a therapist. So the first consideration is that in psychedelic assisted therapy models, so I'm talking about whether that occurs in private practice or in clinical research, touch is generally a part of the treatment. And when I say touch, I'm specifically talking about supportive, non-sexual touch that is negotiated rigorously with the client ahead of time. So we follow similar kinds of guidelines that we follow with any kind of consent, that it can be withdrawn at any time, but when someone is under the influence of psychedelic medicine, they can't extend consent. So a therapist might offer to, say, hold somebody's hand in a difficult moment or in an emotional moment. The next thing that I want to talk about that is not unique to psychedelic assisted therapy, but unique in the way it plays out are projections and erotic transference and countertransference. So psychedelic states can, we know this from clinical research, can induce suggestibility, meaning what is said can be internalized more rigorously by a client. Feelings can be amplified strongly. So when we think about how this operates in terms of sexual boundaries, we have the concept of erotic transference and countertransference that occurs in any kind of psychotherapy. But when we're both sitting in our chairs and everything is kind of buttoned up, it's still difficult to talk about. But when you add a medicine into the mix and you have a person in an altered state who may or may not be looking at the guide or the therapist with these intense positive projections that can even be sexual projections, add that on top of it, the somatic component that the person is having, a somatic experience that can be sexual, sensual, erotic, or difficult. Any of those things can happen. You are in this slurry of sensations and emotions that can lead to a very, very amped up version of erotic transference and countertransference. So what we need is very good education about boundaries and ethics and very good protocols about consent and informed consent. So I want to then just shift a little bit because we're talking about how this all looks in the clinical domain. If you are a therapist or a sex therapist and you are seeing clients around psychedelics, unless you're doing ketamine, probably what you're doing is seeing people for integration therapy, which means maybe you have couples who are out using psychedelics on their own, and then they're looking to process that in their clinical work with you, or individuals who are having psychedelic experiences on their own or in group settings. So talking with your clients about consent in these settings can be a fabulous tool for the prevention of sexual harm. So I have had some disagreement with me, but I will share my opinion about psychedelics and consent when it comes to, say, couples. Um, we talk about consent as an ongoing process, and it absolutely is. But what is unique to the psychedelic experience is that people can have a fairly clear understanding of their own boundaries and consent that can be well negotiated. And then you add a medicine into the mix that can inspire you to feel closer to the person, can make you feel as though those boundaries were maybe too rigorous in the first place, even if you're getting absolutely no pressure from the outside. And what I have seen in couples work is that when people attempt to renegotiate or to bypass their own consent or boundaries during a psychedelic experience, there can often be a really difficult emotional backlash. And sometimes it is not because another person was looking to violate your consent, it is because you yourself felt your own boundaries begin to soften on a psychedelic. So, working with clients in integration and preparation practices to develop consent protocols can be really, really helpful. Um, and then, the last thing that I want to mention is just thinking about where what content we bring into our own psychedelic experiences as well. So one thing I advise, for example, is to not make relationship agreements during psychedelic experiences. This can be another way that boundaries and consent come up. I've worked with couples who have had really robust discussions about, say, like opening their relationship, and then 2 days later feel very violated because they feel like they would not have agreed to those same boundaries if they were not on a psychedelic medicine. So these are all different considerations, and this is a very deep issue. So, Sarah, I'll open it up to you and see how maybe we can build on some of the things I haven't touched on yet.
Totally. Yeah, there's at least a chapter on this in your book, but you definitely talk about this ongoing. And I think that consent has become this very buzzy word, that a lot of us don't necessarily know what that means. Um, but we can often look to like sex positive communities and BDSM communities specifically to help us guide some of the thought around negotiating ongoing consent freely given. There's an acronym that's FRIES, um, and it is about how, consent isn't just a one-time thing. You don't get somebody's consent and then you have it. You are continually negotiating. And one of the pieces that you're describing, Dee Dee, that I think is really important, both in private settings and in clinical settings, is sort of, you can down negotiate consent, but not up negotiate consent, which means, we've agreed that we're going to do these things, or we're going to talk about these topics, or as you say, in a clinical setting, this kind of touch is okay. But then halfway through a medicine session, the client is like, well, actually, I really wanted this thing and I didn't want to ask for it, but now I want to ask for it. And essentially, not sort of going with it because you're in an altered state and it feels good, but oh, you know what, I think that it was okay to hold my hand, but really I don't want to be touched at all. Or, can you hold my elbow when we walk to the bathroom and not my hand, or not put your hand on my shoulder because that's really triggering. Um, so that's one piece that comes up when I'm hearing you talk about it. Emma Knighton is an educator on this and has written a really wonderful chapter in a book I can't remember the name of, but about using BDSM language and what we've learned from BDSM and kink cultures and worlds in psychedelic practice. Um, And Sandra Dreisbach is another educator and ethics writer that I think has a lot to say about this topic, which is really wonderful. Mhm. Oh, yes. The other piece I was going to say is about dosage in medicine specifically. And, you know, other other folks have talked about it plenty, or maybe not nearly enough, but I don't think that this is our role in this particular moment to tell you what a good dosage is or what good medicines are for you. But similarly, you know, starting with a lower dose and deciding if you want to redose later, which is how we work with ketamine. And it's how a lot of the studies work with other psychedelics in general. And sort of knowing your dose, understanding your dose maybe in a solo session if you're going to be exploring with a partner, a lover, or with multiple people. Um, Understanding kind of what this amount does to me generally in these settings, and starting low and knowing that you can go higher, or starting today on a lower dose and knowing next week we can try a little bit higher, or next month, or in 6 months. And I think that goes along with consent. If you're playing with partners in new settings, knowing what substances they've taken, knowing around the quantities, knowing what their experiences are with these substances. Um, and then one more piece that Didi, you'd mentioned earlier, which I loved, this idea of like, kind of knowing the medicine that works for you. Um, uh, it, we talk a lot about like how um, certain substances are better for different things. And when we're talking about sex and psychedelics, a substance like MDMA might be really heart-opening and really wonderful to have a deep, cathartic relationship conversation. But if you're going into an experience expecting, wow, I'm gonna get to, have this really wild erotic experience, that may or may not be true. So another piece of this is kind of holding expectations um, with care and love and tenderness, supporting intentions and coming back to those when you're, getting lost. But I think that that's another piece when we're doing medicine work in a clinical setting, or when you're participating with in a private setting.
Mm-hmm. Yeah, and I can build on that and just add a thought. So if anyone here watching this panel today has heard some of the reporting on some of the boundary violations that have occurred that have been more highly publicized, I just want to speak briefly to perpetrators, not directly to them, about perpetrators. We tend to look at people who perpetuate or perpetrate sexual harm as villains, sociopaths, narcissists, monsters. And I will say, research on people who transgress, particularly in institutional settings, so people who are religious clergy, therapists, a percentage of them do have those personality traits, but that is not the majority. So one of the things in my work that I'm really interested in is how do we prevent sexual harm? As a sexual violence survivor myself, I feel very committed to that. And we have to look at like two different settings in which psychedelic healing occur, and they're not exclusive, but one is what we call above ground work, right? The clinical, regulated kind of stuff that happens in clinical practice. And then we have what is known as the underground, which is the vast majority of how psychedelic work with a facilitator occurs today, occurs in an extra legal context with very, very little oversight. So when we look at who are actually the perpetrators of harm, some of the traits that are actually more common to them is that they are people who are working in isolation, that they are people who are in the midst of a life crisis, and there are people with their own unhealed and unprocessed trauma. So if I think about these two venues and I think about like how we actually prevent sexual harm from occurring, the first thing I would say is that clinical training programs and psychedelic practitioners in clinical practice need excellent supervision and peer groups where they can talk openly about sexual feelings that arise and have unshamed support and how they manage their own feelings and the feelings of their clients. That will prevent harm. And in extra legal settings, what's needed is community, because what often happens is that people who perpetrate harm, when they're thrown out of a community, guess what? They find another community to go and do that in. And so I've really looked at and relied on restorative justice models and ways that we can actually try to prevent harm in the first place and understand why it happens and build more community scaffolding when it occurs. And I think those are all really important things to think about.
Mm-hmm. Mm-hmm. Yeah, just to add the word shame into that also, that there's so much shaming and so much feelings of shame that can arise both from your side as a practitioner and from the patient client side. And when we don't have outlets to process our shame or to converse about it because it brings more shame or shaming, um, it perpetuates the harm.
Thank you. And so, Sura, we'd like to start with you. How do current legal and regulatory frameworks shape or constrain what clinicians can responsibly do then in this space? And how do you see that evolving?
Mm. So I do want to preface with like a I'm not as well versed in the legal framing of every state, and you should look into the rules of where you are. And things are changing rapidly. You know, we all saw this, whatever we can call it, that Trump signed. And so there's a lot of shifting narratives that are happening constantly right now. Um, but one piece that Dee Dee mentioned is right now across the board, ketamine is the one medicine that has been FDA approved and that is widely available for psychedelic assisted therapeutic use. Um, that's important because it is an avenue in, even though there are still questions from a lot of practitioners about how we use that, when we use that, and you know, both what is like legal and ethical. Didi, I'd love to hear actually you speak about this a little bit, but when it comes to having patients come into our office on a substance, that is something that, you know, we've created space for, and I understand there's a lot of uh, I would like to hear what you have to say, Didi, about this gray area. But generally, this is something that can be prescribed and can sort of be above board uh, in all of our states. Then psilocybin is in Oregon and and Colorado, and then in several other states like California, Washington, Massachusetts. There are bills that are getting passed or have been passed for psilocybin assisted therapy or for recreational psilocybin on the sort of coming up. And that will create an interesting new landscape as well. And then there's phase 3 trials. There are different research trials coming with MDMA. Ibogaine is something now that people are speaking a lot about. Um, there's also the religious exemption. So there are psychedelic churches in California and I think in other states as well, um, that can serve a variety of substances. Um, but I think one important conversation that uh, Ismail Ali at MAPS is having amongst others, but he's one of my favorite people to listen to talk about the legal framework. And Lucid News, I think, just published something recently that was in conjunction with them, with him and MAPS, is, who has access to medicines. And when we're working in the medicalized version of this in Oregon, essentially you have to you have to be given psilocybin by a provider in a specific setting. You have to be sat with for a certain amount of time by, someone who's been trained and licensed by the state. And it creates so many barriers for entry, not just financially, but like literally, physically, that it becomes really impossible for a lot of people. And in fact, I just read that 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 a lot of practitioners or a lot of people in the state of Oregon have just signed a petition to try and change this. One reasoning, but also many other reasonings, but is because of people who are terminal and not being able to get to, who have terminal illnesses and not being able to get to treatment centers. And essentially, like, you can't bring the medicine to them where they are, they have to come to the treatment center. But there's many other reasons why this is an issue. Um, so we're on this sort of cutting edge moment where the legal framework is really sort of dictating a lot of what we can talk about and work with as psychotherapists, and practitioners. But there is a lot that seems like it's changing, and a lot of conversation that feels like it needs to be addressed. And Dee Dee, I want to pass it over to you, but one piece that I forgot to thread back is about practitioners, indigenous communities, and people who've been using these medicines and substances in their own frameworks forever, and the legal system isn't speaking to or addressing that, and in fact hasn't, um, changed any of that work that's being done. Some of that can be talked about in decriminalization, which also, Dee Dee, I'd love for you to speak about a little bit more. Um, but but it's a real missing link in this conversation.
Yeah. Um, I will just touch briefly on some of the things, Sura, that you said that you would like me to expand on, because I'm sure we'll want to take some questions too. So, the first thing I will say is that, just to speak to the Indigenous piece, we are, all of the science that we have, all of this regulation that we're doing around what this is going to look like in clinical practice, it's built on the shoulders of generations of wisdom that, by and large, Western science has ignored, much to our detriment. So I will just say personally, I've never even had a psychedelic assisted therapy session, although I have gone to just about every training you can go to, and I've done thousands of hours of them for other people. All of the healing, 100% of it that I have received in my life, has been from Indigenous healers in ceremonial settings.
Mm-hmm.
And so we can't ignore that that is a very legitimate and robust place where some people will find healing, and we could at least mention that. So speaking quickly to some of these points, we can use ketamine in private practice. Ketamine is an FDA-approved medicine as an anesthetic. Spravato, which is an extremely expensive medication that is a version of ketamine, that's not even the whole ketamine molecule, that costs about $800 a dose, is FDA approved for depression. But every time we're using ketamine in clinical practice, we're using it off-label. So that's really important. It's actually not indicated for any of the things we're using generic or racemic ketamine for in private practice. So what's happening is there's a patchwork of different regulations and laws around the country. We could spend a lot of time just trying to explain what's happening in various places. But the most important thing I think I can speak to for this audience is that it's very unclear in most places how the current state laws protect your license as a provider. So that is a really big thing, is that licensing boards, as state laws change, are going to have to evolve in their approach to what your scope of practice is. The religious piece is very interesting because there are only very few psychedelic churches who have fought their way all the way to the Supreme Court or higher level courts and actually are sanctioned to practice in the United States. But there are tons of psychedelic churches all over the place. Well, how are they doing that? They're doing it under the auspices of religious liberty, but all that is doing is providing you of a defense, how you plan to defend yourself if anyone came to arrest you, to confiscate the medicine that you're using, or there were any claims against the work that you're doing. So we're operating in a very, very complex legal gray area. In my own practice, my work is as a clinician, about 50% of it, but I'm also a supervisor, I'm a writer, I'm a trainer. So I have been incredibly diligent myself about following laws very specifically. So I don't provide any kind of extra legal services to my clients. I don't work with them if they're currently in an altered state unless we are doing ketamine work, or I have also worked in clinical trials. I do integration practice. I follow what is in the boundaries of the law. And some of the most skilled therapists I know who have many hundreds of hours more experience than any of the people I know who are working in clinical research are underground providers. So I also want to say, I'm not encouraging, I want to be incredibly clear, I am not encouraging anyone, licensed or not, to break any laws where they are. But I want to acknowledge that a vast trove of knowledge exists in the underground, which clinical research has mostly ignored in the same way that it has ignored Indigenous practice. So.
Thank you so much for naming that. That's really, like, it always feels so grounding to hear that and to meet people that are, in their 70s and 80s who are so excited about this current moment and this shift and this turn towards it, psychedelics being more widely available, and are also incredibly wary of it and have seen, a lot happen over the years. And so I just always appreciate like giving a little nod to our elders.
Yeah, and I'll say one last thing about the regulation piece. This executive order that just got signed, it seems like it should be something we're all excited about. And quite frankly, all it does is provide vouchers to a few pharmaceutical companies that are for-profit pharmaceutical companies that have created synthetic versions of ancestral plant medicines to bring those to market. It is unclear if insurance will cover them or how much it will cover them. So until we know that, these will be designer treatments that are accessible only to very, very wealthy people. It will not create more widespread accessibility until there's a lot of different regulatory things that get questions that get answered.
Okay. Well, thank you both. We're going to go ahead and possibly take some questions if folks want to add questions to the chat. I do have one to kind of kickstart it while people are able to kind of type their questions out. Is where should students go to learn more about psychedelic assisted therapy and or a psychedelic assisted sex therapy? And please feel free to both chime in.
You want to start, Sarah?
Well, sure. I mean, we both have treasure troves of knowledge and information. I would say sexandpsychedelics.com, which we'll link in the show notes. That's not how you say that, but I like when they say that. And so you'll get access to both of our websites, and for us, we're bringing together a lot of the different voices that are speaking on these topics. And so if you go to our website and you go to contributors, there's a long list of folks who are working in this intersection. And anytime there's conversations about this, I would say one thing that I've been really moved by, Monica Cadena is another practitioner in this field who is a journalist, and she created the Sex and Psychedelics Conference the same year that I made the magazine. She's a frequent collaborator of mine, and every time that she loves to moderate panels, is an incredible moderator, and she's always bringing together like really diverse voices that are speaking on radically different pieces of this field and topic. And so anytime that you have the opportunity to listen to a talk or go to one in a setting like this or at MAPS next year, we'll definitely have a bunch. I would say, go to it and see what you can see. There's so many different voices in this field speaking about so many different aspects of this. Um, and Dee Dee is one of them and has such incredible wisdom. And I'll pass it to you, Dee Dee.
Well, the first thing I'll say is there's no specific accreditation or really any training programs that specifically address sex therapy and psychedelics, although different sex therapy institutes are offering psychedelic classes within them. I have taught many of them. So the first thing I would say is I have done work for different institutes and sex therapy alliances. If you are part of an educational program and you have the desire for advanced training, you could reach out to someone like me. You can reach out to someone like Sura or other people in the field. And we often can provide training, come to you with that training. So that is one thing. I also provide clinical supervision around this issue. Practically speaking, the psychedelic training world has kind of exploded. You could go online and put training in and find a million different places that will give you some kind of certificate in psychedelic assisted therapy. Some of them are okay, some of them are less than okay, in my opinion. And I think we have to confront the practical piece that under the current prohibition in which we're living, unless there are very few programs that will work with ketamine for experiential pieces, or they have experiential pieces of the training that exist outside of the country where they can do training sessions with you using psilocybin in legal contexts. They can be expensive. They can be difficult to access. So what I would tell you is if you are interested in integrating this into whatever kind of therapy you do, the first thing is to become excellent at that kind of therapy. Get the best sex therapy training you possibly can. Get the best IFS training you possibly can. Get the best EMDR training. Whatever you do, become an expert at it. And then I will tell you the thing that no one's going to say. Find a context that is legal and safe for the identities you hold, especially if you are a person of color, a queer person, a person who holds any kind of traditionally marginalized identity. Find contexts where you can safely and legally do this work and then do it. Because the best way you learn about holding space for other people is to know the psychedelic experience yourself inside and out, to have been through that vulnerability, because you cannot teach that. You can get the training in how to actually hold space for a person during medicine relatively easy. There are some fairly accessible educational programs that will give you that. But what you can't learn is how to be an excellent therapist and how to navigate altered states yourself, and mostly the intense, emotional, vulnerable, heart-opening experiences that actually happen on the medicine. I think being well versed in that is worth more than any education program can give you.
Thank you. We do have a question in the chat. Can you speak to the intersection of spirituality and psychedelics a bit more, especially when working with patients who have experienced religious trauma or identifies as an atheist?
Sarah, do you want to start with this?
I think you should start with this because this is so central to the work that you do, Dee Dee.
Yeah. Yes. So not to shamelessly plug my book, but there is a lot about spirituality in here. So first, we often, I think, many clients who have experienced religious trauma, specifically around sexuality. And I do really consider that a trauma. So I'm thinking, when I think about trauma with people, there's the obvious traumas, but there's also all of the ways in which our conditioning from various places, including organized religion, prevent us from being present with pleasure in an enduring way. And I would consider that a form of trauma. To me, I can answer this question briefly in two different ways. A client's spiritual beliefs as they exist when I begin to work with them are very important to me. So I'm modifying the questions I'm asking them, the prompts that I'm giving them, the way I'm helping them prepare or integrate a psychedelic journey based on their existing spiritual belief system, showing full respect to their existing traditions culturally and spiritually. And that is going to require you as a therapist to do extra legwork to really learn everything you can to operate from a place of cultural humility. For me, being an atheist is not a obstacle at all to doing spiritual work with psychedelics, because for me, spirituality is about connection. It is about how connected are you. So a person can have a deeply spiritual experience with nature. They can have a deeply spiritual experience with another person. They can have a deeply spiritual experience with their own body, and God or a higher power just may not come into that for them at all. And that's something I completely respect. So when I think about how we heal in the spiritual domain, it's not about the acceptance of a dogma or of any kind of higher power. It might be really asking the question, how do we help that person fully turn on to the experience of connection? And not just in a practical way, in a transcendent way. What is the somatics of being connected to nature? What is the embodiment, that practice of being truly connected in love to another person? And I frame that as spiritual. If a person rejects that language, then I'm curious about that with them. But I'm really clear with my clients that spirituality doesn't require any kind of particular belief system.
Mhm. Mhm.
We have about
Yeah,
1 minute left, just so you know.
okay. I'll just add in, like, maybe folks feel uncomfortable with the word spirituality that we're working with, and so maybe it's just wow factor or a feeling of intensity or overcome with just with feeling or flooded with emotionality in a way that is new for them, or a way that pushes them to a space that they have opening experiences, like Dee Dee was speaking about before, of awe, of revelation. And it doesn't have to be a religious or even spiritual context, but it can be whatever that is for that particular person. And I think just specifically about religious trauma is something that DDU speak about. And, if that's something that you're interested in looking at, I highly recommend Dee Dee's book um, on that topic. If we have a moment for closing words, I just feel really grateful to get to talk about some of my favorite topics here with you all. Our magazines have a breadth of information and conversation, from practical to spiritual to interviews with different people who are working in this world. And so I also recommend that you can tap in there if that's something you're interested in, and feel free to get in contact with me at any moment.
Closing words for me, Dee Dee, before we.
Oh, just a profound thank you to everyone from Adler and to Sura who invited me into this wonderful experience today. And, my information will be shared, and you can feel free to reach out for any kind of further support that you might need. So thank you so much.
And on behalf of Adler and the two student organizations, I want to say thank you both so very much for coming in today and sharing some insight and wisdom that you've collected. Very grateful for your time today. For folks in the audience, please note that their information has been shared in the chat in case you want to look them up or try to connect with them further. So yes, thank you both so much for your time today. We really appreciate you.
Thank you. I actually have a client, so I'm gonna sign off, but it was wonderful to see everyone.
So nice
Thank
to see
you.
you. See you soon.
I just don't know where the seat. Oh, there it is.